Good morning, everyone. Nice and warm out there. I'll have to turn the AC on, but then again, it could be Denver, Colorado, so spring is right around the corner. Today is the Ides of March 15th. I want to again thank Dr. Mark Kerouac, the CEO and President of Bay State Health Systems, and Dr. Robert Roos, the Chief Medical Officer for Mercy and Trinity Healthcare, for always faithfully being here, and for all their continued leadership efforts with their staffs and families. Appreciate that. To Patrick Leonardo, the Director of Operations for AMR. You've been a great partner, Patrick, and I'm glad your mom's doing better. To our sign language professionals, thank you again. We deeply appreciate you being here. To my cabinet heads down the rank and file and their families, thank you from the bottom of my heart. Tested and true through a number of natural and man-made disasters. We appreciate that. I'd also like to thank Focus Springfield and the media, the TV and print and radio media, for faithfully getting out that information. We appreciate that immensely. And to the residents and the business community, thank you. We have continued to try, and I believe we have put across sure and steady and faithful leadership to you, and we appreciate your continued understanding and your patience and your cooperation as we defeat this COVID-19. With that, we'll go to the stat sheet. Total confirmed cases since this ordeal began over a year ago now of confirmed COVID-19 cases, 18,473 cases. Monthly totals are at 638. The weekly total was at 326. Deaths, unfortunately, we did have 3 more. And my thoughts and prayers and sympathies and encouragement go out to the affected families. That brings a total of Springfield residents who have been taken away from their families and friends and from us to 227. Of that, 95 are white, which encompasses 41.8%. 49 are black, which encompasses 21.5%. 76 are Hispanic, which encompasses 33.4%. 7 are Asian, which encompasses 3%. Some updates. Commissioner Helen Kalten Harris, again, done an outstanding job. Our VaxForce Town Hall of respected members of the medical community, the neighborhood community, and communities all about. Very diverse group. We'll be doing our town hall this Tuesday evening from 6 to 8 p.m. and that's going to be live and broadcast from different venues. This will have some short presentations from the subgroups, and then mainly to take questions from the viewing public, and again to reassure them that this vaccine is safe and sound and much needed for themselves and their families. Many times I think people put about politics. This is not about politics. This is about public health. And I've always said that conspiracy theories don't solve medical challenges. Vaccines do. Had some conversations over the weekend with Governor Baker. He has again reached out. We're very appreciative of the neighborhood vaccination sites we're going to do Springfield specific for underserved populations. But we're also talking about possibilities of doing even more here in the city of Springfield. So stay tuned on that, and I'm very appreciative of Governor Baker's efforts. Stop the Spread with AMR continues testing up at the Eastfield Mall. Commissioner Kalten Harris has indicated to me she will continue to stop the spread or testing at Rebecca Johnson. That will continue there. I was up at the Eastfield Mall Thursday. It was morning or early afternoon, and the curative site has been running very smoothly up there since we intervened, so we're very happy about that. Commissioner Kalten Harris and I, again, were the Springfield Housing Authority specific vaccines went designated from the state, and my former Chief of Staff, Denise Jordan, now the Executive Director of SHA, those shots went very smoothly at Boland School, a few hundred there, and that was done. We did the neighborhood vaccination sites that were announced, and Commissioner Kalten Harris will go into that more and when she speaks, and that's very appreciative. State Representative Buddy Williams and State Representative Carlos Gonzalez have really worked hand in hand with us, as with Governor Baker and Jose Delgado, former aide of mine, was his rep now was there also. Commissioner Kalten Harris also did a Black COVID-19 town hall with Rep. Williams last week to continue to get out the facts and information to give people the proper backup for when they make that decision, hopefully, to take that vaccine. Senior meals continue to be delivered at home to those seniors that are in need. We continue our telephone banks through Health and Human Services, the libraries, Molly Fogarty and team, Elder Affairs, Sandy Federico and team, Sheriff Kochi has a telephone bank, and also State 211, Governor Baker, United Way, Paul Mina. They continue to help navigate for residents needing to make appointments to get vaccinations. A big thank you goes out to President Biden and, of course, our very own Richie Neal, Congressman Neal, Chairman of Ways and Means, who really crafted this $1.9 trillion stimulus and relief COVID-19 bill and shepherded it through Congress. As usual, we'll be having an updated meeting with my cabinet heads and Congressman Neal very shortly on getting into the devils in the details on this bill, but much needed relief to the residents and business community and state and municipal government. So to President Biden and Vice President Harris, and especially to Congressman Neal Ritchie, thank you very much. Judge Ireland, we continue with DOJ. Had another very good conversation late Friday afternoon, early evening, and thankful to Ed Pakula and Commissioner Clapper and all. We are making headway, as the judge indicates that, on a potential DOJ agreement, and we look forward to when we can fully update you on that. I was with Dr. Roos, the one-year anniversary in Mercy Hospital with COVID. That was a very nice ceremony, very heartfelt that was done there. With my pal, our pal Bob the Bike Guy Charlin up at Eastfield Mall. He's a one-man wrecking crew. Councilor Jesse Letterman also joined me. He opened up a shop there to help out kids in need of bikes, and just very heartfelt. He's put so many smiles on young people's faces throughout Springfield and Western Massachusetts, and also has worked very closely with our men and women in blue across Western Massachusetts to help people in need and homeless population. I'll be doing an update for the Realtors Association this week with Kevin Sears. The Oasis Food Pantry continues. John Foley, the Food Bank of Western Mass. Sodesco at Central High School. Again, they're servicing about 3,500 families every Friday. St. Patrick's Day is Wednesday. Happy St. Patrick's Day. Within the COVID-19 restrictions, there will be the St. Patrick's Day Parade Committee indicates to me that there will be a Mass at Sacred Heart Church at 9 a.m. We will do a flag raising at City Hall at around 10:30. And then we're going to do a car parade for our seniors at the Raymond A. Jordan Senior Center from 12 to 2 with Sandy Federico and Helen Kalten Harris. And on the parade committee, I want to thank Carrie Sullivan. I know we can't all be together, but we have to keep traditions going. On the police front, Commissioner Clapper indicates to me there's only one down with COVID-19, which is fantastic. Our illegal dirt bike detail continues, working with the state police. We took off 20 illegal dirt bikes and made 17 arrests last week. And we're going to continue to hammer away and put the heat on these illegal dirt bike drivers. Fortunately, it was a narcotics and gun arrest, the 18-year-old, but an arrest and narcotics were made. Our next police academy is coming out April 7th. The majority of those are Springfield graduates. We have other departments that we help out that will be graduating. More information will come on that. The DOJ meetings continue. I appreciate Commissioner Clapper's efforts and Solicitor Pakula. The fireworks legislation, I thank Councilor Victor Davila. He's finally gotten that to come out of committee. I believe that's before the City Council coming out tonight, as we've moved the illegal dirt bike legislation also to put some teeth in it. Commissioner Clapper and I continue to work with the custody medical monitor bracelets activities, and we're hopeful to make an announcement very shortly. Again, Sheriff Kochi working with Pat Sullivan and Commissioner Clapper. The park patrols will resume again. It's been very beneficial and very welcome, that partnership. Thank you, Sheriff Nick Kochi. Fire, Commissioner Calvi indicates to me they're only down one with COVID-19. Very good. The latest Fire Academy will be doing something, I believe, Thursday. They're coming out, the many academies we do. We had a fire situation at MCDI that we'll pursue. Seems to be young kids arson there and securing that area. At Forest Park, there was a bit of a brush fire, Trafton Road, the Camp Angelina Star, the wood tree area there that was knocked down. DPW Director Chris Signoli indicates to me nobody is down with COVID-19, which is fantastic. Pothole repairs continue. The street sweepers are out. Yard waste pickup again, I say, will start March 30th. Central Street, which is a tremendous transformation has occurred over there. The street reconstruction is going to start up, and just tremendous progress has been made there. Director Signoli will also indicate to you we are in desperate, dire need, as soon as possible, to hire traffic signal technicians and CDL drivers. This is an issue that is causing problems across the Commonwealth. But we need traffic signal technicians and we need CDL drivers, ASAP. So you please apply for that, and hopefully if you have the requirements, we can bring you on board, but having tremendous amount of difficulties getting those specialists throughout the state. Superintendent Warwick indicates to me meals we have now served students and families 6,586,016. This week alone, 76,612 meals were served. School committee, we took a vote last Thursday evening, 4-2 vote, that we're going to reopen. Hybrid transition, we're putting in a appeal for the hybrid transition to DESE, Commissioner Riley. Staff will come back March 29th. April 5th, K through 5. Middle schools, we're looking at April 20th. Commissioner Riley and DESE has not given a date yet for high schools on that. Later this afternoon, I do have a Springfield Empowerment Zone Board meeting, school meeting. DESE has just recently put out there's specific dates, 4 dates for teachers and school staff, that the 170 sites will be dedicated completely to the teachers and to the school staff, that you can book appointments to get your vaccine, plus all the CVSs will have taking specifics for the teachers, educators, and school staff. The website for the 170 sites, and again, these specific dates are just for teachers, educators, and school staff, is www.mass.gov/COVID vaccine map, and also www.cvs.com too, and that's from Desi. And again, these are dedicated for educator, teachers, and school staff. On the finance, my Chief Administration Financial Officer, TJ Plan, indicates to me since this ordeal has started, we're down $8.8 million in deficit spending. We've lost about $3.9 million in FY21 budget. We've spent, for the residents and business community of the city of Springfield, $34 million in deficit spending and grants. Been able to pawn off $25.5 million in grants, still $8.5 million outstanding in deficit spending. We continue to develop our FY22 budget. Again, we're very appreciative of the $1.9 trillion COVID relief stimulus package from the federal government. And we're going to go through the devil's in the details of the amount of money that Springfield potentially can receive and where it can be used to continue to benefit residents, business community, and keep core services going here in the city of Springfield. Facilities, Director Pat Sullivan indicates to me that there is nobody down with COVID, which is fantastic. Pat and his team have done an outstanding job retrofitting our schools and our public buildings above and beyond which has been required on the ASHRAE standards, so we can continue to preserve and protect our workforce. He's working very closely with Commissioner Helen Kalten Harris, and as we continue to develop vaccine neighborhood sites. We also, again, with the Park Patrol with Sheriff Kochi, that's coming back, very successful and welcome. It's a great partnership. And a special shout out to Dennis Sullivan, that's Pat's brother, one of the head guys, the hands-on guys that the community service work out of Sheriff Kochi's office. They've done a tremendous amount of work for the city in partnership. And Dennis retired, so to Dennis Sullivan, thank you very, very much, and we're going to miss you. A very hard worker, and a lot of projects got done with what I call the residents or inmates of Sheriff Kochi's crew, and it's just been an outstanding partnership, and a lot of skills have been utilized, a lot of skills have been learned from those individuals to get a second chance. Echo Dev, my Chief Development Officer, Tim Sheehan, nobody down with COVID. It's fantastic. The state, that $200,000 on the outdoor dining that's being put in effect. One of the first projects we'll be doing will be on Fort Street for the fort. Director Sheehan continues to review the small print on the federal package that has come across on the $1.9 trillion to see where we can continue to use that for business relief. Also, we'll be putting out an RFP, a minority woman and veteran for state certification, DCAMP certification, technical assistant. That's the key. As I said, I think Friday or Thursday, you could be the Michelangelo of your trade, but if you're not state certified, DCAMP certified, I can't get you on the playing field to compete for these projects and jobs. So we look forward to doing that. We had a meeting with Council President Marcus Williams, who's been great to work with, and Councilor Melvin Edwards, who heads the REO, and Theo Licules, the Deputy Director of Procurement, and my aide, LeVar Click, who will be Coach Click, will be the point person on that. On the law, HR, and labor front, nobody down with COVID. Solicitor Pakula, again, has been instrumental and valuable in these DOJ meetings, continue, and also pertaining to the marijuana RFPs that we have out there. Public presentations, by the way, tour evenings this week will go on, and Attorney Bill Mahoney updates on labor and HR, and we are down, state unemployment is now down to 7.8%. It went down again. So we're very hopeful. The last time there was a pandemic and there was a knockdown, the roaring 20s occurred. So as Yogi Bear would say, hopefully deja vu again, and we have the roaring 20s again in 2020s without the stock market crash, obviously, in 1929. So without further ado, I'm going to bring up the CEO and President of Bay State Health Systems, Dr. Mark Kerouac, and then subsequently Dr. Robert Roos, the Chief Medical Officer of Mercy and Trinity Healthcare, to make their presentations. They've been invaluable. Right after their presentations, so they can get back to their important duties, we'll take questions or comments from the press. Dr. Mark Kerouac, thank you.
Well, good morning, everybody, and thank you again, Mr. Mayor, for holding these events and for the cooperation of your team. Happy to hear that COVID is making such a light impact on your departments. That really is good news. I also want to thank the media for their continued efforts to share important scientific information with the community, and now marking a one-year anniversary. Yesterday, in fact, was the one-year anniversary of the first COVID-19 case at Bay State Health. Those early days were very much a whirlwind. We went from 1 to 180 cases, with 40 in the intensive care unit in just 4 weeks. And the guidelines around how to protect yourself were, at best, the best guesses of the leading authorities. We were unable to test a single individual. We had to send all testing out to the Department of Public Health or to a commercial lab, which led to days of delay. And it meant that for every known case of COVID, we had 4 or 5 suspected cases that were in isolation and requiring us to wear personal protective equipment. That caused a rapid burn of PPE at a time when our usual sources of supply were shut down. And we had to go through some very creative things to ensure that we were protecting our people. Over 600 Bay State Health employees were redeployed to new duties, some of which had never existed before. Over 4,000 began to work from home and really put a strain on our IT services, but we were able to get them up and running. We adapted very quickly to this unknown disease, and there were some very important clinical innovations that happened, particularly around avoiding mechanical ventilation. Bay State was one of the early adopters of non-invasive approaches, which saved lives and reduced the burden on the hospital. The second surge came in mid-November, which I think was even more challenging than the first. The system spent over 12 weeks with over 100 cases, and the determination of the staff was extraordinary, because there was not the sort of celebratory environment or atmosphere that characterized that first surge. The year saw some pretty grim statistics: 3,045 folks hospitalized, 485 deaths, 290,000 people were tested after we became a regional testing center in late April. 9,185 were diagnosed. The strain on our staff shouldn't be underestimated. We have 12,000 employees. 1,600 of them took early retirement or resigned as a result of the pandemic. As I mentioned, 600 were redeployed. We brought on 2,200 new hires. The vaccination program has taken off like a shot in the last couple of months. Over 46,000 vaccines administered, roughly 80% of our employee base, but also 12,000 in this latest phase 2 of folks who are older or with chronic conditions, including 680 educators. We expect that group to grow fairly quickly. Our faculty physicians at UMass Bay State, we're a regional campus of UMass Worcester, published 32 publications in peer-reviewed journals with scientific discoveries or insights around the pandemic. And this one was kind of, it made me smile when I read it. As of March the 1st, 1,819 media appearances by Bay State leaders and experts, and all in the interest of advancing public health, and we do appreciate that opportunity. I think what's not captured in the statistics is the fact that we all now are looking at the world in a different way. This has upended our traditional worldview. I think it's shown the world to be a a more disordered and harsher place than we used to think before. There's been a new emphasis at Bay State on our workforce, the safety, the inclusiveness of our workforce, their engagement, and securing pipeline programs so we'll be competitive for talent into the future. One of the insights for me personally has been, as a physician who became a CEO, I focused for years and years like a laser beam on what was happening to patients. And I think as a result of working so long and so hard to protect our staff, I realize it's equally important to keep our staff healthy and engaged so that they, in turn, can focus on patients. There's been a new focus on customer convenience. We have begun to question some of our traditional ways of taking care of patients and getting work done. The success of virtual healthcare has persisted even as we've reopened for clinical services to the point where it now accounts for about 30% of the ambulatory visits at Bay State Health. Thousands and thousands of visits each week done successfully. And so this will certainly become part of the new toolbox for providers at Bay State. Flexible work arrangements too. We have 4,500 people working from home. And when they come back and how much they come back, I know many other industries are going through this, but I suspect that hybrid arrangements will become the norm and more flexible kinds of hours will become the norm going forward. Lastly, there has been an increasing role of Bay State Health as a partner in public health efforts, community education, community outreach, and something I welcome and I think has really improved the coordination with people like Commissioner Kalten Harris and other boards of health, and has placed Bay State in a role as a convener, educator, and partner for all of these efforts. I think the other thing that I've been thinking a lot about, and something I've communicated to the organization about through a video and a blog just this week, is the recognition that this epidemic has been a traumatic event for everybody, not just healthcare workers, but everybody has gone through something. You may not have lost a loved one, but you may know someone who did. You've had to give up a lot of the things that you really thought were important. And if indeed we think of this as a mass traumatic event, it's important to take time to recognize its impact on all of us, to process what's gone on, to talk about it with people you trust and people who you love, in order to make sense of it all. What does it all mean to us? My hope is that we can all sort of put this in context and create our own narrative of what's really happened to all of us, and hopefully recommit with a greater sense of community than we had before this pandemic. I think that there is, in addition to these well-known phenomena of post-traumatic stress disorder, where people sort of deny or bury traumatic events, there's a well-known phenomenon of post-traumatic growth, when people begin to realize what it's meant to them and how they've changed, and to actually try to keep what's good about those changes. Let me move from the retrospective to what's happening now. We're continuing to see a lot of cases in the local area, even though the rates are going down, not only locally, but across the state and the country. Globally, we're at about 120 million, 2.6 million deaths. I'm sorry to see that Europe is again resurging. Italy today is entering a 3-week lockdown again, because Europe is behind America in terms of their rate of vaccination, and they really let up on the public health measures. And as a result of these highly contagious variants, they've seen a much more rapid spike, and are pretty much shutting everything down for 3 weeks. And you can imagine how discouraging that is to this country that's been through so much. In the United States, 29 million cases, 534,000 deaths. Some states are seeing rising rates, Missouri and New Jersey, for example. And I'm keeping a real close eye on Texas and Florida, where they've opened things up, and weeks from now, we'll see if they end up paying a price or not. However, across the country, on average, new case rates are down, 53,000 a day. That's a pretty high number of cases in an absolute sense, but remember, we were over 250,000 a day back around the New Year's. Only 35,000 in the hospital, and only, quote unquote, only 1,300 deaths a day. In Massachusetts, we're averaging about 1,100 new cases a day and 29 deaths, 6,600 in the hospital, and again, remember that was usually weeks ago in the thousands. We've gone from 145 towns in the red zone category to only 14. That's the good news. The bad news is that Springfield, Ludlow, and Chicopee are 3 of those 14 towns. They are seeing declining cases, but they're not declining as fast as other cities. The same is true of Hampden County. All counties are seeing a decline in cases, but some are going down faster than others, and that's meant now that Hampden County is number 1 in terms of new case rates, even though the rates are going down. At Bay State Health, we actually have had 3 days under 60 cases this last couple of weeks, and this morning is one of them, 52 cases across the system, 42 in Springfield, 10 in our community hospitals, 9 in critical care. So that's a very low number, the lowest it's been since mid-November. Our vaccination rate continues to move through phase 2, as I had mentioned. The eligibles include folks over 65 or with more than 2 of the chronic conditions listed by the state. Educators have become eligible just last week. The United States has given out 107 million doses. Nearly 70 million folks in the country have received 1 or more. That's nearly 30% of the adult population, and the experts estimate that nearly 50% of the adult population is immune either through vaccination or through actual infection. And remember, herd immunity is not some magical number where there's an on-off switch. The more and more people that are immune, the lower the rates of transmission are going to be. We are picking up the speed of vaccination, which is also a very important metric, now doing over 2 million shots a day. And so I agree with the President that that 4th of July backyard barbecue is a very realistic prediction. Massachusetts has administered 2.5 million shots. That's 89% of the doses received, with 1.7 million people getting at least 1. And that includes 60,000 of this new Johnson & Johnson vaccine, although we've not seen that out here in Western Mass, to the best of my knowledge. There has been no increase in the federal allotment to the states, and none is expected till the first week of April. However, the separate pipeline to retail pharmacies like CVS and Walgreens has amped up, and a number of them have announced increasing numbers of locations. As a result, the average number of shots per day over the last 7 days has gone up to 52,000 a day. So we're getting close to that 80,000 mark of 40,000 first doses, 40,000 second doses. Bay State continues to get its same allotment, 2,000 first doses of Moderna, plus as many second doses of Pfizer as the schedule requires to keep us on track. That means 600 to 800 shots a day. We do sub-allocate, as I've mentioned before, several hundred doses to our health centers here in Springfield and to the Springfield Housing Authority, as well as up to Greenfield. I was very happy to see that the neighborhood program that Commissioner Kalten Harris and the mayor and the legislators have advocated for is going to be opening in the next few weeks. It is certainly needed given the red zone status of Springfield, so I'm really very, very pleased. In summary, I think we are near the finish line. We are seeing the light at the end of the tunnel, name your favorite image, and it's going to be important for us to keep our discipline and not blow it in the last few months. We don't want to become like Italy, that is to say, letting up on the public health measures prematurely. We need to continue to push on to rapidly vaccinate as many adults as we can. And until the case rates are very, very low, we need to continue our discipline around the masking, social distancing, and avoiding crowds. But it's getting close, and I continue to be optimistic about the summer. So until you're eligible for vaccine, remember there's still virus around, even though the numbers are declining. It's no time to relax now. So please continue to follow those measures, and please get yourself vaccinated as soon as you're eligible. So again, I'll thank you, Mr. Mayor, and I thank the members of the media as well for your consistent science-based reporting.
We'll now have Dr. Robert Roos, the Chief Medical Officer for Mercy Hospital Trinity Healthcare.
Thank you, Mayor, and thanks for your continued leadership and that of your entire team. And again, thanks to the media as well for continuing to report out. Hope everybody had a nice weekend. The sun's been very bright for the last few days, and I agree with Dr. Kerouac. It does appear like we are seeing the light at the end of the tunnel. We are not there yet, but with each passing week without any setbacks, we are much closer to emerging from this long and cold, tragic winter together. This past week, we at Mercy Medical Center took some time to commemorate the one-year anniversary of the declaration of the COVID-19 pandemic by the World Health Organization on March 11th. We had representatives and frontline colleagues, some nurses, and our Chief of Emergency Medicine provide some very moving testimonials on the impact that this has had on them, on their lives and their families, and on the community. We heard stories of resolve and strength, and we took a moment to reflect together, both on what had been accomplished, but what is also still yet to be done. I look back with some awe at some of the milestones that we at Mercy Medical Center did cross over the course of the past year. Having treated more than 900 hospitalized patients with COVID, discharging over 800 of them, but with 105 people dying from this disease under our care. We rapidly developed ways to test for the coronavirus early in the pandemic and modified that over time, now having performed over 102,000 coronavirus tests, diagnosing more than 7,500 people here in this community, and have now vaccinated over 10,000 or provided over 10,500 vaccinations. It's truly been a remarkable year, one that in many ways we will never forget, but we all hope to emerge from. The news now does continue to be positive, and that the trends are moving in the right direction, driven by the effectiveness and the pace of vaccination. As mentioned at a national level, we've now had over 29.5 confirmed infections, which underrepresents the true total, over 535,000 deaths, but the numbers of infections per day and the hospitalizations does continue to go down. The past 2 weeks, the 7-day average of new infections declined by about 20%. It stands now around 50,000. Agree, it's not yet what I would call a low number of infections, but it is moving in the right direction. Here in Massachusetts, there have been over 568,000 confirmed infections, 16,000 deaths. Yet the positive trends have continued. The past 2 weeks, the decline of the 7-day average number of new infections has dropped by about 30% and is down to about 1,000 to 1,100 per day. The test positivity rate has flattened a little bit, but slowly declining, now at 1.67%, and hospitalized cases declining by about 30%, now down to 666 this morning. And at Mercy Medical Center, we saw the largest drop in hospitalized cases in 1 week since we have back in May. As of this morning, we are caring for only 6 COVID patients in our hospital, 3 of which are in the intensive care unit and have been receiving treatment for some time. So to me, taken all into context, all of the different trends at a national, statewide, local level, it tells me a couple of things. First, it reinforces the fact that vaccination works. The vaccines we have are highly effective, and they definitely and nearly completely prevent symptomatic and severe disease, and we're seeing that in the declining rates of hospitalized cases. There is also growing evidence that these vaccines are effective in reducing viral transmission, viral loads, and asymptomatic infections as well. Of course, we knew that that was theorized, but that was not the outcome in the clinical trials for which the vaccines received emergency authorization. But there have now been several published reports including one pretty recently looking at about 600,000 people vaccinated and 600,000 people unvaccinated in Israel, showing highly effective the ability for these vaccines to reduce even asymptomatic transmission. There's also been studies amongst healthcare workers, several thousand in the United Kingdom, where receiving an mRNA vaccine has reduced a documented viral infection, even asymptomatic, by 85 to 90%. So this is great news. Secondly, I think that the declining rates also show the appropriateness of the prioritization that was determined by the CDC and then largely followed by most states, including here in Massachusetts, where those people that are most at risk of severe illness and healthcare workers receive the vaccine first, followed by others at risk, and then essential workers who are in contact with large numbers of people who may spread the illness. This is validated twofold, as I see it. First, even with relatively high numbers of infections, the majority of the infections now are occurring amongst younger people and healthier people, and we're not seeing elders hospitalized or succumbing to this disease, particularly those from nursing homes, as we did in the earlier surges in the pandemic. And as a healthcare system, we really are not seeing our frontline workers infected with COVID anymore. In fact, we've had days where we've had no colleagues throughout Mercy Medical Center and affiliates out of work with COVID. And that's allowed us to keep the vital resource of our healthcare system intact, keep our colleagues safe, and has preserved our ability to care for anybody without any limitations. At a statewide level, we've been monitoring hospital capacity for many, many months and are now moving back into Tier 1, which means that there is more than adequate hospital and ICU capacity. And so just as we have throughout the pandemic, we continue to provide all types of care and services at Mercy Medical Center and in hospitals across the Commonwealth. Care from emergency care to surgical care to maternity care to primary and preventive care. And in fact, if you're somebody who's delayed or deferred any type of care over the course of the past year, now would be a very good time to reach out to your provider. There continues to be concern. Early in the pandemic, we worried about people staying out of the emergency department. Now, as a provider, I worry about people that have delayed those screening exams or wellness exams, things like colonoscopies and mammograms. People that have not had the screening test that they otherwise would be recommended. Sadly, we've seen diagnosed with cancer at later stages than we would otherwise have expected. And so we care about your health, we care about your well-being, and encourage you to not delay getting back to those types of screening exams or wellness visits. This week happens to be National Patient Safety Week, and we at Mercy take a moment to reflect on all the ways that we can reinforce safety in the care that we provide. We are proud to have received the Leapfrog Grade A for patient safety this past year, and we've continued with all of our protocols to keep people safe amidst the pandemic and otherwise. And as a community member, you don't have to be worried about our capacity. We have capacity in our emergency department, where we have a guarantee that we strive to see everybody within 29 minutes. We have capacity in our medical groups, where we've evolved to be able to provide visits at your convenience, either in person or via telemedicine. And we have capacity in all of our imaging departments, where you can get that mammogram or schedule that CT scan or X-ray within 48 hours if you need it. There is nothing about the past year that's been easy. It has impacted all of us in myriad ways. It's changed everything that we do and the way that we look at the world. We have recognized that as part of Mercy Medical Center, and we've then decided that we want to make things as easy as possible as we can for you. It's not only going to be easier to see providers, but it's also going to be safer. And the more and more people that are vaccinated, and as the infection rates go down, we will all be able to engage more readily in the community. We believe that's a good thing. It's a good thing if it's done appropriately, it's done at the right time, and done in a safe manner. And it's especially true for people that are hospitalized, who often need support from their loved ones. And that's why last week we made an important change also in our visitation policy at Mercy Medical Center. Recognizing the value of the support of loved ones, starting last Friday on March 12th, we began allowing one adult visitor for all of our non-COVID patients in our inpatient units, in the emergency department, and for those having surgical procedures. Minors under the age of 18, including newborns, will be granted 2 visitors. Some of our outpatient areas, like our imaging areas or our oncology areas, will continue to restrict their visitation based on their departmental policies. All visitors will continue to be screened upon entry to the facility and will be asked to keep their hours to 12 p.m. to 8 p.m. and adhere to the time limits as requested. But this is a positive step and one more sign that we are moving in the right direction. As has been mentioned and we've been talking about for weeks, all of this positive news is predicated on the continued escalation of the vaccine campaign. And so I want to continue to strongly encourage anyone eligible to accept the first vaccine that is available to them. According to the CDC, more than 107 million people, more than 107 million vaccines have been administered, and 37 million people have received the full series. That's 27% of the adult population having received one vaccine and about 15% having received both. 63% of the population over the age of 65 has received one vaccine, and about 35% of the population over 65 is fully vaccinated. In Massachusetts, having now administered over 2.5 million doses, representing 89% of those that have been shipped here, and over 900,000 people being fully vaccinated, that represents about 16% of our adult population, which is slightly better now than the national average. As you know, and it was mentioned, President Biden announced last week that he expects that there will be enough vaccines for the entire adult population by the end of May, and is pushing states to make all the vaccine available and all individuals eligible as soon as possible. And I agree, if this happens, this could just be the timeline that we need to get back to the activities that we've been waiting for over the summer and that we rely upon. Of course, it's dependent upon how much supply we receive here in the Commonwealth, but it does appear that if we continue to escalate and increase the numbers of vaccine administered each day, that could be a realistic goal. For individuals that are interested in pre-registering for when they are going to become eligible, the state has set up a new website at vaccinesignup.mass.gov, where you can be notified the moment that your category, based on age or other criteria, makes you eligible for vaccination. At Mercy, we continue to vaccinate as many people as we can with the supply that we are allotted. For us, that supply has not changed. Week over week, we continue to receive 1,100 doses of Pfizer each week for both first and second doses. As of today, we've provided over 10,500 vaccines, and more than 4,600 people in our community have been fully vaccinated. We will continue to push the state to allocate more vaccine out to Western Massachusetts and Hampden County in particular, so that we can have our rates relative to the rest of the state increase. And I want to acknowledge the town hall that's going to be hosted, and thank you, Mayor and Commissioner Kalten Harris, for the VaxForce Town Hall that will be tomorrow evening. We're proud to have one of our representatives, Maggie Aboso, our Infection Prevention and Control Coordinator, as part of that important group, and recognize how important it is to get that evidence-based education out to all members of our community. And so, just in closing, want to reinforce the fact that there's been a lot of good news over the past several weeks, but there still is some more time to go. So please, don't let up now. If you're eligible, sign up for vaccination as soon as you can. If you're not, continue to stay safe and remain vigilant. If we do this for a bit longer, we will put this behind us. The coronavirus may never go away, but the trauma and the impact of this pandemic can and will be overcome. Thank you.
Thank you, Dr. Roos. Dr. Kerouac and Dr. Roos will now take questions or comments from the media. I know Victor Molina, Division 22, Eric, 40, Paul, Matt.
Dr. Roos, I kind of jumped the gun on Dr. Kerouac last week on this in terms of how our Martin's anniversary about how Western Massachusetts region in particular has been the greater Springfield area. I just want to get your comments on looking back how the greater Springfield area did relative to state or nationally, but what your personal opinion on this situation is.
So I think, and I, regret not being here last week and, really have appreciated, I'll just start, I think, by commenting. I think one of the things that we've done really well in Western Massachusetts is collaborate. And I want to, commend Dr. Kerouac for his leadership as both a convener and educator, as mentioned, in Bay State Health for helping push many positive developments in how we address the COVID pandemic here in Western Massachusetts. On a personal level, I think that we have largely done very well. We experienced this pandemic perhaps in slightly different ways than some of the urban areas that were more densely populated and struggled with capacity challenges to pretty severe extreme measures. I think what we've done well here was try to stay one step ahead in terms of anticipating what some of the challenges would be, plan collaboratively, and execute to the extent that we can as quickly and as flawlessly as possible to keep people safe. What that has led to is slightly lower rates in terms of ICU admissions and deaths relative to some other areas. And I think here we're seeing, our approach continues to be one where we are pushing for, vaccination at the time when we need it most. So looking in retrospect, comparatively, I think many lessons to have been learned, but fared fairly well here in Western Massachusetts comparatively.
And on the subject of vaccination, I opened going with the state released public health data showing some of the breakdowns of who is getting vaccines in every community, particularly by race. And I was wondering if you had a chance to see any of that data and if you had any comments on what it shows. There is a pretty severe distance between what white residents are receiving versus what people of color are receiving.
I'm not sure what data you're speaking about, but every week they do have a breakdown by race and ethnicity. And if you simply compare the percentage of vaccine doses given to the percentage of folks by race and ethnicity in the population, you would say that, it's probably 50% lower than you would expect it to be for communities of color. And part of it has to do with the way they rolled the vaccine out. That it was first to healthcare workers, home care workers, first responders, and then people over 75. And I suspect in all of those categories, they're disproportionately more white than the general population. The question of what the data looks like now, let's say in the second phase and third phase, is really going to tell the tale. And I think a lot of the efforts that the state has made to get vaccine into the inner cities, the 20 hard-hit inner cities, I think should rebalance that. But some of the disproportion that you're seeing has to do with the way the rollout was done and the fact that the elderly have been hard hit by COVID, and because of differences in life expectancy, there are more white people proportionally over 75 than people of color. It is up to us, I think, to really make sure that going forward, we've got a equitable apportionment of vaccine, and I think programs like the one that's going to be happening here in the next few weeks should move us in that direction.
And just as another thing to think about the year having gone by, I know that earlier you did the opinion that it wasn't necessarily prudent to shut everything down at the first sign of infections going up. In retrospect, do you still think that was the right recommendation? I know you said later that if the cases continue to go up at the hospital, you might jeopardize basic capacity. That never happened. But for the most part, you seem to be of the opinion that we didn't need to seize everything up when we start rising infections. Do you think that you still made the right call in retrospect in terms of
I think a shutdown is something that you do when your information on how the spread is happening is limited, and that was certainly the case in April. So the shutdown that we did in April not only was the right thing to do, but it was a signal of the fact that our knowledge base was not complete. By the time we got to the summer, and we understood an awful lot more about how the virus spread, particularly the asymptomatic spread issue, I espoused the fact, and I still do, that it is possible to do many of our customary activities like open schools, go to restaurants, be in gatherings, that sort of thing, that are limited as long as we observe the public health guidelines. I think that the places that have done this and have done it religiously, many of the countries in the Far East, for example, have done extremely well. And the places that have got into trouble, like Italy most recently, have decided to really back away from that. So I do think that a balanced approach wherein you observe the masking, social distancing, hand washing, etc., allows you to do certain things rather than just be in total lockdown all the time, which would have had its own devastating effects in terms of mental health and the economy.
Any other questions or comments? Hector?
Question for Dr. Roos. I asked Dr. Carrot this last week, so maybe get your take on it as well. We've seen a lot of these new variants, and a lot of people are concerned whether it's an issue, is it's not, could it impact, how does the vaccine protect it? Just wanted to get your take on that.
Yeah, so we've been talking about this now for probably about a month and a half, as we started to see variants noted as variants of concern, particularly B.1.1.7 that was coming out of the United Kingdom. The more that we learn about the variants, the more that my opinion, and I think others, is informed by that information. I'm not particularly concerned at this point because of the fact that the vaccines appear to confer significant effectiveness against particularly that variant, and then likely other variants as well. So we do need to continue to monitor it and study the variants. There's been suggestions that some of them are either more infectious to a particular degree, perhaps maybe even more severe in some cases. But right now the focus should and continue to remain on escalating effective vaccinations and the public health measures that have prevented infection from the beginning. As we learn more, and as we, if we in fact see more of it, it's a possibility that may change. But at this point, the same principles that have applied, I would say, are the ones that we need to reinforce now.
And for either going off the surge we're seeing in Europe, should there be any concern for us here, or are our vaccination rates kind of keeping up and preventing that from happening?
Our vaccination rates are ahead of those of Europe, which is really a good thing. The concern that I have is that we're going to let up too quickly on some level of public health protections, for example, the way they have in Texas or Florida. I worry that they may be heading for trouble there. Could be wrong. I hope I'm wrong. But as fast as you go with vaccine, it may not be fast enough if you're not also buying yourself time with the public health measures.
I would agree.
Any other questions or comments? Dr. Roos and Dr. Carroll? Gentlemen, thank you so much.
Pleasure.
Stay well, you and your staff and family.
Thank you.
Thanks, Billy. We'll now bring up the Commissioner of Health and Human Services, Helen Kalten Harris.
Thank you, Mayor, and as always, thank you very much for the support and the guidance. As the Mayor said, the City of Springfield now has 18,473 cases. The cases by date: Sunday, 52, Monday, 46, Tuesday, 20, Wednesday, 31, Thursday, 67, Friday, 62, Saturday, 48. The cases by age: 0 to 10, 29, 11 to 20, 58, 21 to 30, 67, 31 to 40, 64, 41 to 50, 48, 51 to 60, 35, 61 to 70, 21, 71 to 80, 1, 81 to 93, and 91 to 100, 0. The cases by zip code: 01, 1, 0%, 03, 7, 2%, 04, 71, 22%, 05, 35, 11%, 07, 24, 7%, 08, 39, 12%, 09, 66, 20%, 18, 22, 7%, 19, 31, 10%, 28, 3, 1%, 29, 10, 3%, 51, 17, 5%. The cases in the last 9 weeks, I'm going to go back to January 10th and tell you that that was the highest month that we saw, 1,177 cases. We are now at 326 cases the week of 3/7. There are 65 cases less this week than last week, but from that 1,177 number, there has been a 72.3% decrease in the cases in the city of Springfield. The 30 and under is 47%, 31 to 50 is 34%, and 51 and older is 19%. And so 81% of the cases last week were under the age of 50. The highest month was December with 4,496, in January 4,342, February 2,170, and March so far 638. The race: 27% unknown, 1% Asian, 19% Black African American, 24% Latinx, 29% white. Last week, it's important to acknowledge that 2 race areas increased. One is Asian, that went up to 2%. It was 1% last week. Black African American was 13% last week. It is 19% this week. 26% last week was Latinx. That has gone down to 24%. 31% last week was white. That has gone down to 29%. It is important to highlight those areas that we are seeing decreases and increases. As the mayor said, we lost 3 individuals in the city of Springfield to COVID-19. It was a 63-year-old white male, a 73-year-old Black male, an 81-year-old Hispanic female. Again, the mayor has given our condolences. We continue to keep those families in our thoughts and in our prayers. The testing has gone very well. I am so appreciative to AMR and the work that they have done. They have tested 159,493 individuals. 70,045 of those were Springfield residents. Of those numbers, 14,787 were positive. So we are always appreciative of AMR. In addition, they have helped the city of Springfield vaccinate over 3,000 individuals. Again, we are grateful to AMR and the fact that they are our vaccination partners and have been willing to stand up with us sites as we have brought them on. So thank you to AMR. We continue to test, obviously. We are testing at Eastfield Mall, that is AMR. As the mayor said, we're going to, at this point, because of low utilization, we're going to shutter our Kennedy site. We have had single digits there, so we are going to shutter that site. However, we will keep Rebecca Johnson open. The numbers have been a little better there. However, they are low as well, but we will continue to assess that site as we move forward. So we are still getting positive cases in our city. Obviously, you've heard that Springfield is still in the red zone. And so we continue to need everybody to work with us in our city, all of our residents, to make sure that you are following good public health practice. Our staff, along with the Contact Tracing Collaborative for the Commonwealth of Massachusetts, does still do the contact tracing. And so it is still important that you answer those phone calls and that you give us the necessary information so we can contact those individuals that you come in contact with. We still are concerned about isolation, making sure if you're positive, you isolate, also making sure those individuals that you come in contact with are quarantining. VaxForce will have its town hall. The town hall has been called Our Neighborhoods, Vaccine and Our Neighborhoods. And so I invite you, there is a poster to my left that is announcing the town hall tomorrow from 6 to 8. Again, there are an amazing group of professionals that will be taking your questions and giving information. Remember the categories: healthcare, research, operations, education, faith, diversity, equity, and inclusion. Those are the categories or the committees that VaxForce has, and you will hear from each one of those committees and their work. Saturday, the teachers have been highlighted, but let me tell you that the teachers have 4 designated dates, and you've heard that. Saturday, March 27th, Saturday, April 3rd, Saturday, April 10th, and Sunday, April 11th. Those dates are just for K through 12 educators, child care workers, and K through 12 staff. And so again, we encourage all of our teachers and those who work in our schools and our educators to please take advantage of those days. The days are very specifically for you. Vaccines, and so vaccines in the city of Springfield, I'm going to give you a little data about how we are doing in the city of Springfield. 0 to 19-year-olds are 44,958. 29% of our population in our city is under the age of 19. They have received 126 or 1 dose, which is 1%. 20 to 29, the population base is 26,944. They're 17% of our city. They've received 1,699 1 dose, which is 6%. The 30 to 49-year-olds in our city represent 38,388. 25% of our population. So far, there have been 5,130 doses given, which is 13%. The 50 to 64-year-olds represent 17% of our population. They have received 5,058 doses or been vaccinated. That's 20%. The 65 to 74-year-olds, which are 12,152% of our population, 8% of our population have received 4,298 doses, which is 35%. The 75 and over year olds of our city represents 7,978, which is 5% of our city. They have received 4,681 doses, which is 59%. Let me clarify that this is one dose, one single dose. This date is of March 9th, and the population of that age group is taken. It's based on 156,245 individuals. So I just want to be clear that we would expect that the 64 and older or 65 and olders would receive more of their first doses because they were eligible. So it doesn't surprise us that those other age categories are low. However, just to have 8% of our individuals from 65 to 74, we want to make sure that those numbers continue to rise. The 75 and over, 59% of those individuals have been vaccinated. The travel orders. Persons who have been fully vaccinated, have 2 doses of Moderna, 2 doses of Pfizer, or 1 dose of the J&J, and have been vaccinated more than 14 days ago and do not have symptoms and do not need to obtain a negative test prior to traveling or do not need to quarantine upon arrival to Massachusetts. There's more information on the mass.gov website. I would ask you to go to that website and get information. As the mayor indicated, we are standing up 3 sites in our neighborhoods. On March 23rd, St. John's Congregational Church. On March 25th, the South End Community Center. On March 26th, Harena School. The times will be from 9 until 12:30. Those links will not be, they will be available through neighborhood organizations, and we will absolutely make sure that we are giving information around those links and how to access them. Again, these are neighborhood sites. Our goal really is to get into the neighborhoods and offer vaccines. We have sent a proposal to the State Department of Public Health. They have approved our sites, said that they would get back to us around additional vaccines and our ability to access them. We will be standing up different sites. We will have sites that will be permanent and ongoing. And when I say permanent, I mean for a couple of months so that people will know that those sites are there. We are currently assessing sites, hopefully that we can control across the city, working with Patrick Sullivan. One of the challenges that we know right now is that the schools will open and teachers will be going back in, and so we certainly have to make sure that we are choosing sites that do not interfere with our educators and the work that they are doing. I want to thank the staff of the Department of Health and Human Services, the cabinet for the city of Springfield, our healthcare workers, and all who are working through this pandemic. We want to ask you to continue to wash your hands, wear your face coverings, and wash your distance. I agree with both of our doctors when they said there is a light at the end of the tunnel. We are also saying there's a light at the end of the tunnel. And I told one of my colleagues, I agree with the light at the end of the tunnel, I just don't want it to be a train. And that would mean that it's something coming towards us versus something that we're seeing at the end. And why do I say that? Because unless we do those things that everyone is talking about in the public health community, then there is the possibility that we could see a resurgence. We want to give people hope. We want to say that we are moving towards the end of this pandemic, or at least a place where we have controlled the pandemic to the degree that we can enjoy some type of a normal existence. We also understand clearly that unless we get this pandemic under control in Springfield, I'm specifically talking to us, unless we get this pandemic under control economically, we are not going to be able to do all of the things we want to do, and we certainly don't want to go backwards as far as all of the successes that all of you have helped us with. So I just want to thank our residents for working with us. You have been absolutely amazing. We've asked you to sacrifice. We've asked you to isolate. We've asked you not to hug, shake hands, the things that we were so used to doing. We understand your emotional and mental health has been impacted, and we do want to get back to a place where we can enjoy some of the things that we used to do. We can only do that with your help. So I am asking you to continue to work with us, continue to have patience, and continue to have hope, and continue to believe that we are going to get through this. Thank you.
Thank you, Helen. Thank you, Commissioner Kalten Harris. I don't know if I had brought up when Helen came up here to the, on the deaths, as Dr. Kerouac, Dr. Roos indicated, long-term care facilities has really stayed status quo for a long time. 59 have passed, 26%. The residential's now 168, 74% on that. We're now going to move to the public safety component, and I will bring up the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi.
Good morning, everybody. Thank you, Mayor. At the fire department, we only have one person out with COVID this week, so we continue on a positive trend as far as COVID infections. That's due to the hard work of all the men and women at the Springfield Fire Department for their vigilance and making sure everything's clean, sterilized, and they're paying attention to mask use on a daily basis. This is, we sprung ahead on the clocks this week, so everybody please remember to change the batteries in your smoke detectors and carbon monoxide detectors. Also, if you could check your dryer vents at this time of year, make sure that you don't have an excessive buildup of lint, and clean those out if you do, because those can also cause fires. As the mayor stated, we had a arson fire at MCDI on Friday evening. There were some younger people who got in there and started a couple incendiary fires inside the building. Just as a warning, do not go in these abandoned buildings. Most of these buildings are marked with an X, which means we will fight the fire from the outside. If you become trapped in there, we will not be able to get in there and get you. They are condemned buildings and unsafe for us to go deep into and mount interior firefighting operations. So stay out of these buildings, and if you get apprehended lighting fires, that is a felony, and they usually carry pretty severe punishment from the court system. That's all I have for today. Thank you very much. Thank you, Mayor.
Thank you, Commissioner Calvi. And before I bring up the Commissioner Clapper, just another update I forgot on the illegal dirt bikes. In working with City Councilor and State Representative Orlando Ramos, he has also found a unique niche. I think they're doing it in Brockton, where they, if you are driving those illegal dirt bikes and ATVs on city roads or streets, you are not allowed to purchase gasoline at gas stations. And I believe the council representative spoke to me about it a week to 10 days ago. I believe he's introducing that to the council very shortly. That'll be another tool in our toolkit that when they're on it, you can't get gassed up. Now, if they do it, but you will not be able to get gassed up. That'll be another hindrance to them. Without further ado, the Police Commissioner of the City of Springfield, Cheryl Clapper.
Thank you, Mayor. The police department, as we stand today, is only down one due to COVID. We are graduating the recruit class, and that is thanks to the hard work of Deputy Chief Bill Cochran, Lieutenant Thomas Zarelli, and his staff out there at the academy. Through COVID, we're able to get this class through. It's much needed, so I thank them for their hard work and diligence in it. They graduate April 2nd, and then they will go into a training program that we'll design for them so that they get some experience before the nice summer weather months pop up on us. We did conduct the illegal dirt bike and ATV last week, from the middle of the week to the end of the week. very successful, 20 seized, 17 arrests. 3 of the seized were stolen. So, and I appreciate the hard work from Councilor Ramos, Representative Ramos, and Senator Gomez, and the city councilors. Anything they can do to help us in this fight is going to be greatly appreciated, because we put all this time and work into it, and what happens is if the bikes end up, we hold them for 21 days, then there's an auction. They know where the auction is, and it just recycles, and back it comes to the streets. So we appreciate all the help. The gasoline ordinance will help us. It'll control where they can go to refill. I love the destruction ordinance. If no one claims them after 21 days, they can be crushed and destroyed. That'll keep them from coming back at us. And any other ordinances or any other avenues they can give us to keep the enforcement up, so that we don't deal with this all summer long. Narcotics did make another arrest and another loaded firearm Friday night of an 18-year-old, Giovanni Sykes. We continue to do great work in narcotics. We continue to seize illegal guns as well as all the other operations that we have going. And I thank the men and women of the police department, both sworn and civilian, for their hard work during this time. Thank you, Mayor.
Thank you, Commissioner. Thank you, Mr. Clapper. Well, we'll now get an update from the superintendent of schools, Dan Warwick. He and his staff have done a masterful job. It's a balancing act, and we're at the point in time now where we can start to safely transition hybrid to get our students, families back into school. Superintendent Dan Warwick.
Thanks, Mayor. Good morning, everyone. As the mayor said, very, very proud of our staff. Since school closed down, which is just a little over a year ago, we've provided 6,586,016 meals for our families, 76,612 just this weekend alone. So again, great job to our staff, Pat Roach and the team, and the Sodexo team for reaching out and making sure that we had this set up to go. And when we open schools again, we're going to keep the same 18 sites, but for the kids who aren't coming back, we're going to provide the meals in the evening after school closes. So that's still going to be available to families, whether they choose to come back or not. Vaccinations, as our commissioner said, and just as a reminder, we have 4 targeted dates for our school staff. That's all school staff. As the commissioner said, 3/27, 4/3, 4/10, and 4/11. Again, just for school staff to help us in the reopening process. So that's very, very good news, and we're going to continue to do everything we can to help school staff all get vaccinated before our reopening. As it stands now, we're going to comply with DESI's ordered phase-in, and on April 5th, we're going to reopen pre-K to 5, all our elementary schools. We're going to add on to that grade 6, and then our 3 specialized programs that we've wanted open first from the beginning. Our high-needs special education students, our ELL SLIFE students, and our vocational grades 10 to 12 at Putnam. So again, that first phase will come in April 5th. Our second phase will come in April 26th after the school vacation, and that'll be grades 7 and 8. Our third phase, our high school phase, the commissioner has not announced the dates for high school yet. Harder to keep the kids clustered to high school, so he made that the last phase, and that makes a tremendous amount of sense. So as soon as we know on the high schools, we'll announce it to the public. In the meantime, we're going to have our staff return to the schools on March 29th. We've done all the ventilation work. It's safe for everyone to come back, so our staff's going to come back, phase in, and where the students haven't come back yet, they'll be doing the remote from their classroom. Most other systems have already done this. Because of the great work of the team, with the mayor's support, we put $1.4 million into our ventilation systems. And again, thank you, Mayor, for that. And with Pat Sullivan riding herd on it, we've upgraded all of our ventilation systems. All of that work is going to be done before anyone comes back into the buildings. So great progress there. Again, with the mayor's support, we've provided a lot of extra technology for our kids, but for our staff. When we come back, the staff is going to be doing concurrent learning, and we've purchased DocuCams for all the teachers to use, as well as a second laptop. So as they're doing the instruction for our remote and our kids who show up to schools, they'll have all the technology they need to do that. Fall 2 sports are going on right now. Again, thanks to our health commissioner, we did testing before we started. The kids were all clear, so we were able to get a start on that. And I'm so grateful to the commissioner for all those good suggestions on getting that going. That's so important for our kids. We've also kept all our clubs and other extracurricular activities going. So I think that's, again, a very important piece for our kids in this return. You know, we've waited a long time to get back to school. We've been closed down for over a year. And during that time, it's been hard on families. There's a lot of mental health challenges, as Helen was talking about. And we've faced a number of serious issues. And it's important to get back to school for our kids and run as many of these extracurricular activities as we possibly can. Thank you.
Thank you, Superintendent Warwick. We'll now get an update from the Department of Public Works and Director Chris Signoli.
Mayor, thank you.
Thank you, Chris.
The DPW has no employees out with COVID this week. Our yard waste program will be beginning on March 30th, Tuesday, March 30th. So after March 30th, whenever your recycling date falls, that's when we will be starting yard waste. And just as a note, bags that have been left on the curb all winter will not be picked up. They need to be rebagged. And barrels that have been out all winter will need to be, material needs to be taken out, because at this point they're all filled with water and we will not be able to pick them up. Central Street construction starts again today. Utility work around the city will start on March 29th. And as Superintendent Warwick mentioned and the mayor mentioned, school will be starting on April 5th. It is going to be extremely interesting. The city's going to have traffic again because there's going to be a lot of people out, a lot of school buses. So I anticipate that there's going to be a lot of issues related to traffic, as we have not seen traffic for at least a year now. Our street sweeping program has started for this year. And as the mayor mentioned, however, we are having an extremely difficult time getting qualified applicants for both driver positions, CDL positions, and traffic signal technicians. These positions have been open for months, and we've had a very difficult time finding people. And it will, at a certain point, really start to impact our response times on things, especially issues related to traffic signals around the city. We've had a lot of controllers hit. We had one hit 2 weeks ago again, and a lot of knockdowns on weekends. So that is going to start to impact our response times on those. That is it with regard to the DPW. Thank you, Mayor.
Thank you, Director Signoli. And again, it's pothole season. 311. If you see a pothole, please call 311, and that will get the Director Signoli and his team. Now, the update of facilities and parks, and Director Sullivan and his team have done a tremendous job. Director Pat Sullivan.
Thank you, Mayor. We have 0 out with COVID. That's great news. All schools and central office have been inspected for a second tour, and I'm very happy to report that schools are ready to open in the city of Springfield as far as the air systems go. In non-COVID news, we've gotten a grant for $60,000 from the Mass Preservation Fund, and that's to study City Hall with the concentration on the windows. So, Mayor, thank you for your support on that. And then we're preparing the parks for our spring openings. And I want to assure the residents with the brush fire that you might have seen if you live near there. Over the winter, we've started a program with Commissioner Calvi. We're working with the U.S. Forest Service and mapping all the the woodlands throughout the city, and when that's completed, we'll work with Commissioner Cavi to prioritize grants from the federal government to clean up our woodlands. And then last, I want to thank the residents of Springfield for their cooperation over the last 2 weeks. We used the tent for tax collections, and everything went very smooth. We kept over 1,000 people out of the building on a daily basis using that tent, so thank you for your continued cooperation.
Thank you, Director Sullivan. Again, Springfield's in the business of doing business, and Chief Development Officer Tim Sheen and team have done a great job of funneling out grants and monies and support to keep our businesses going. And now the stimulus, this $1.9 trillion stimulus relief package, we will again utilize that to keep our businesses going and help them thrive. Chief Development Officer of the City of Springfield, Tim Sheen.
Thanks, Mayor. As the Mayor said, the American Rescue Plan Act passed last week. It's one of the most important pieces of legislation in our lifetimes. Beyond what the Act will do for family, businesses, and governments that have been negatively impacted by COVID, it seeks to regrow the economy in a more equitably. By way of example, the poorest fifth of households will see their income rise by 20%. Child poverty will be cut in half. More people will have access to affordable health insurance coverage, and early childhood education will be vastly expanded and economically supported. As the Mayor said, a tremendous thank you is owed to Congress, especially our own Congressman Neal, who was so directly involved with this important legislation. And just by way of update, we are reprogramming $20,000 of the CARES Act funding to deal with business-related public infrastructure and right-of-way improvements to assist businesses with outdoor dining. Responses to the Gemini RFP are due on Friday at 2 p.m. There has been significant interest in the RFP, and we remain hopeful that there will be multiple responses filed. And we continue to plan for the future as we sought council approval last week of the Main Street Convention Center Master Plan and Section 108 loan application to HUD. Thank you.
Thank you, Director Sheen. I also want to thank City Solicitor Ed Pakula for his update, and HR and Labor Director Attorney Bill Mahoney for his update, and my CFO TJ Plant financial update, which I gave you all earlier. With that, we will open it up to any questions or comments from the media pertaining to my cabinet heads and/or myself.
Mayor, was your conversation with the governor, was that a conference call with the mayor, or was that just a one-on-one conversation?
One-on-one.
And can you just describe in a little more detail what happened in that conversation? What you discussed? What's going on?
We discussed about getting more vaccines here to the city of Springfield, not only neighborhood aspects, but something even more. And I'm very grateful for his reach out. And at the appropriate time, once the T's are crossed and the I's are dotted, we'll have more to announce. But all about relationships, and Commissioner Helen Kalten Harris put on a good plan that Secretary Sutters and Health Commissioner of the State, Monica Morrell, really liked on the neighborhood aspect. So we're going to continue on that neighborhood and the underserved, but there could be some distinct possibilities of something hopefully bigger happening here pertaining to the city of Springfield. So again, I appreciate Governor Baker's outreach as he continues to lobby the feds, and we continue to work together on the state level, and stay tuned. Yes, dear. Say it again about St. Patrick's Day, I'm sorry.
Is there any concern for a spike in COVID cases with students going to spring break and then also having St. Patrick's Day coming up?
Again, I'm a layman on this. I'm going to bring up Commissioner Helen Kalten Harris, and I think Dr. Kerouac and Dr. Roos had spoken on it. I'm a little concerned because of some of the aspects of Florida being sort of wide open, Texas sort of being wide open. We made a lot of progress here, balancing act, basing our decision on public health medical and the sciences, but also trying to keep economic development going, following the criteria. So would I be concerned about that? Yes, but I'm going to bring up Commissioner Helen Kalten Harris. She could speak more specifically. We've had other holiday events or other events where spikes have been seen, and I think we're all, as Dr. Kerouac and Dr. Roos indicated, we're all going to be looking at this very closely to see what spikes might, hopefully don't, but might occur really coming from Florida area, the Texas area, Georgia area, Atlanta. But Commissioner Kalten Harris, you good? Let's talk to her, okay?
So thank you for asking that question. Yes, there is concern. There's concern across the country that during spring break, individuals will leave and then go to other parts of the country and then come back to their hometowns and potentially spread the virus. So we are concerned. The word is out there. We are asking, begging young people to make sure that you are keeping in mind that although your outcome for your health may not land you in the hospital, you can certainly infect those you love, care about, and your families. So just like any holidays, St. Patrick's Day, potentially Easter, spring break, we do get concerned, and we want to keep going in the right direction as far as this virus is concerned. So thank you for the question. But the mayor answered it perfectly, didn't he?
Oh, you're too kind, Helen, too kind. I wanted my Dr. Anthony Fauci to answer that. You got something else for her?
Yes.
Okay.
With businesses, is the health department going to be making sure businesses are following certain protocols this weekend with St. Patrick's Day? Or the businesses are crowded?
We will continue to follow up with our businesses. Our restaurants are very aware and have been very supportive and have absolutely complied with the governor's orders. But it certainly is our job to make sure that there is compliance. We do not want to see our infection rates rise because of unauthorized gathering. We still know that the majority of our infections are coming from small and large gatherings, and we did see a spike in our colleges or institutions of higher learning. So yes, to answer your question, we are still out there in businesses, the stores and restaurants, just to eyeball. But again, let me be clear. It appears from what we've seen to date that our restaurants and our businesses are complying with the governor's guidance.
The commissioner's absolutely right. They really, majority, if not all, have worked hand in hand. And when they look to do something, they will contact whether my office or licensing director, Attorney Alicia Days, or Helen's. Helen gets inundated and asks, is it okay if we do this? Can we do this? Can't we do this? And how, if we could, how can we do it? Or we can't do it. So they've been actually very good. And we appreciate that and respect that as we balance health, public health, and helping them make a living also too. Any other questions or comments? Okay. Again, I want to thank everyone, and I want to thank the media, the TV media, the print media, the radio media, for being here. And I want to thank my cabinet heads and rank and file, tested and true, and all the efforts there and their families. And I want to thank you, each and every one of you, the residents and business community of the city of Springfield. There is light at the end of the tunnel, as Commissioner Kalten Harris has indicated, and Dr. Kerouac and Dr. Roos. We want to make sure that that light is of hope, salvation, and defeat of COVID-19, and we need to continue the balancing act of public health and also moving things forward and following those guidelines, which are extremely important. We must not let our guard down. If you're on a football field now, they might say that we're on the 10 or 15 yard line, and you want to carry that ball all the way into the end zone. So let's keep doing it. Helen and I will keep advocating diplomatically, but in an aggressive way, to bring more and more vaccines here to the city of Springfield proper, and get the shots in the arms, and then we'll continue to go through the 1.9 trillion American the stimulus relief COVID fund and see what we can, and we're very thankful again to President Biden, Vice President Harris, and especially Congressman Neil Ritchie, who really was a stalwart on putting this across and forming it on how we can utilize this money to help out you, our residents, you, our business community, city services, moving forward. So let's keep on the roll. Let's be cautious, and good health to you all. Go out and have a great day, and God bless. Thank you very much.